Welcome to the Supporting Young Hearts The Heart to Heart series, a podcast to help support the emotional health and well-being of younger adults living with a heart condition, have had a heart event or heart-related surgery. The Heart Foundation acknowledges the traditional owners and custodians of country throughout Australia and their continuing connection to land, waters and community. We pay our respect to them and their cultures and elders past, present and future. I'm your host, Carly Weiner, a clinical psychologist working alongside the Heart Foundation with a special interest in young people and chronic health conditions. Living and managing with a heart condition can have an effect on every aspect of your life. On today's episode, we'll be chatting to member of the Supporting Young Hearts community, Caitlin Rigby, and Olympian Sammy Kennedy-Sim about how they haven't let their diagnoses slow them down, as well as providing tips for other young people living with a heart condition.
Everyone should acknowledge how they feel, and then you can progress from that and find out how you can move past it.
The journey is never linear and no one's experiences are ever the same. But if we take a unified front, together we can actually conquer absolutely anything.
We also chat to Professor Clara Chow about developing a strong relationship with your cardiologist to best support you along your recovery.
They have to have mutual trust, but also mutual respect for each other in terms of where they're at.
And later, we chat to Heart Foundation Patient Support Manager, Pauline Ryan, about the role the Heart Foundation can play in your heart journey. Throughout this series, we want to support, connect and inform you to help you best manage your heart health and emotional well-being related to the unique stage of life that you're in. For more information about what we discussed today, or if you need further support, please see links in the show notes or visit heartfoundation.org.au. Caitlin Rigby has been living with a congenital heart condition her whole life, but it was not until it worsened before she had to have open heart surgery. She was 18 years old and in the first semester of uni. Sammy Kennedy-Sim is a two-time Australian Winter Olympian and currently training to qualify for her third Olympic Games. Back in 2013, Sammy suffered a small stroke due to a hole in her heart. They're both here to share their stories. So I might start with you, Sammy. Can you tell us where your journey started with your heart condition and how you coped with it?
Thanks so much for having me. My heart condition is called a patent foramen ovale, a PFO, which everybody is born with. And most people have this hole in the heart closed up naturally over time by the age of about 7. Mine didn't close up, which isn't that uncommon, and most people live a very happy, normal life with this condition. Unfortunately for me, I am an athlete in a very extreme sport and I'm quite susceptible to injury. So I had a little routine knee surgery prior to my first Olympics and had a blood clot make its way through this little hole in my heart, and that changed my life forever. About 2 days after my operation, I was in bed at about 6 a.m. and my beautiful cat Sochi, who's named after the 2014 Winter Olympic stop that was my Olympic debut, she jumped on my freshly operated knee. And for those of you out there who've had any kind of surgery, you'll know that any kind of knee-jerk reaction when you've had a sort of trauma like that to a limb or to a part of your body, you kind of have that like jerk reaction, and I wasn't expecting to sort of wrench my knee up into my chest, and that dislodged this clot. And what I didn't know at the time was that I had this PFO, and normally, if that wasn't there, if that hole in the heart had closed up as I was a child, a blood clot would have travelled through to my lung, and most of the time, the lung actually filters out blood clots. Unfortunately for me, that blood clot went through this hole in my heart and up to my brain, and I suffered from an infarct stroke. It obviously was a life-changing event for me, which it's kind of mean to place the blame of that on my cat. Obviously, I choose to see the fortunate side of this situation. Fortunately, I was at home. I wasn't driving a car. Fortunately, I had my husband, Ben, next to me in bed. He wasn't at work yet. So within 7 minutes of having the ambulance called, I was actually in a hospital in Canberra receiving a drug to dissolve the clot that had lodged itself in my brain. So keeping in mind that I was about 24 at this point and I was but 9 months away from my first Olympics, talk about a derailing event in your life. Talk about an obstacle. Talk about a speed bump. Well, this was mine. And like I said, I was fortunate that I was in the right place at the right time to receive the right treatment.
In terms of recovery, how long were you in hospital? How long did it take you to recover physically and mentally from that?
My rehabilitation was successful. I was paralyzed on my left-hand side. I had a full facial droop on the left-hand side of my body. So I had to rehabilitate my body to do the normal things like be allowed to drive a car again, walk, let alone try and go to the Winter Olympics for ski racing. And I'm really fortunate that because of my attitude, I believe that I saw this as a speed bump rather than a roadblock. And I really persisted in my rehabilitation. And I think to me, it really heightened that setting goals for yourself, regardless of what those goals are. That goal might be that you want to be able to walk up the flight of stairs at your house, or walk around the block, or to the other end of the spectrum, represent your country at an Olympics. These goals for yourself are really, really important in any kind of recovery.
And something that I love about your story, Sammy, is that you really empowered yourself to find more information, find people that almost told you what you wanted to hear and kind of confirmed what you believed in yourself, that recovery was possible and that you could get back to living. I mean, you were, 9 months away from the Olympics at that point. So you had to hustle, didn't you, to try and find answers and try and find ways to rebuild your strength?
Absolutely. I wouldn't say that I was finding people to give me the answers that I wanted to hear, but it was definitely there was some compromise there. It was looking pretty shady there for a while that my lifelong aspirations of being an athlete were being sort of put to bed, so to speak, which as a young person was really, really hard to hear. And it's interesting, when I say surrounding yourself with people who you trust and who know you and respect your values, it's not that you will get told what you want to hear, but you actually start to believe that the right answer is the right answer for you. And if my Olympic debut couldn't have happened in 2014, I don't think that I would have exited sport completely. It just would have been, like I said, a speed bump, not a roadblock. So having those people in place around me to sort of know when to push me and know when to pull me in, and really make sure that I wasn't over exerting myself, because that would put me at risk of, having further complications. I mean, I travel a lot outside of COVID. So I was on heavy blood thinners to manage my condition, which when you're doing an extreme sport with a massive concussion risk is quite concerning. So we sort of had the people around us to question what we were doing, and having that belief in the process and really owning the process and making it yours makes it a lot easier to sort of incorporate into what your new normal will be. And that's reflective of our current situation now in the world and also in these sort of health instances, I believe.
Well, your attitude is so impressive given all that you've been through. I do want to come back and ask both of you a couple of questions. So I just want to get to Caitlin. And Caitlin, I'm wondering, you have a similar journey in terms of being born with something, but unlike Sammy, you knew that you had a congenital defect. So what can you tell us about what it was like growing up with that?
So when I was born, I had a bicuspid aortic valve, and we always knew it was there since birth. But growing up, for the first 10 to 12 years, I had yearly checkups, and I never had surgery when I was born. They told me sort of essentially that you have this birth defect, but it probably won't affect you. You'll probably still be able to go a long, healthy life, potentially with no surgery at all. And I was told that if I did need surgery, it was more likely to be a lot further down the track, like 30s, 40s. They told me that, my condition was very stable, still the same, so we could do checkups every 2 years rather than annually. And so that continued until I was 17, about to turn 18. And I went to a new cardiologist because I'd gotten older, and so I needed to go start to see an adult cardiologist. And she essentially told me that in the previous 2 years, my condition had become severe and the leaking of my valve had become severe. So that was sort of the first time where I really thought about my condition, because previously I always knew I had it, but in a sense, it didn't really affect my everyday life. I was never a sporty person, unlike Sammy. So I never really noticed it. And so when I was told that it was becoming severe, that was sort of the first time that it really registered in my brain that there was potentially something that was going to happen in the next few years, and I was going to have to sort of come to terms with my condition and what it meant for my life. That was about June of 2018. So I was in my final year of school. I was about to do my HSC. So I came back to my cardiologist in December, and she essentially told me that we would be looking at surgery within 3 to 5 years. So even at that point, that to me was quite intense, because I'd sort of assumed that I wasn't going to need surgery, because I'd spent so long being told, you're stable, don't worry, everything's good. And so coming to terms with even surgery in 3 to 5 years at the age of 17 was quite confronting for me. Sort of as what Sammy said, I was very persistent to get to my goal. And for me, that was uni. Uni was something I'd been looking forward to for many years. I'd worked really hard to get into my course. And so I didn't want to be set back by this surgery just because it happened at such a young age. I was 18. And so I didn't want it to affect the rest of my life. I still wanted to make sure that I was on track for my career and for the rest of my life.
And you have a journey of a lot of shock and things creeping up really quickly for you. So how did you cope with that shock?
Coping with the shock, I think prior to the surgery, I was very naive and I almost distracted myself and didn't really think about the surgery, which looking back was probably not the best way to deal with it. I think I should have acknowledged what I was about to go through and sort of prepared myself. But I essentially distracted myself and tried not to think about it. And I think it's because I'm quite an anxious person. So I thought that if I think about it too much, I'm going to freak myself out. But then after the surgery, since I hadn't prepared myself, it was almost too shocking. And so that was quite difficult to deal with, especially at such a young age when there's not really anybody else your age that can relate to something like that. So afterwards, I basically associated myself with the support group on Facebook. It's not even that I had to engage in the Facebook group a lot, but just knowing that it was there and knowing that if I ever wanted to reach out to other people who had similar experiences, they were there, was really helpful to me. So yeah, I basically just surrounded myself with people who could support me and people that I knew had my back. And then associating with some new people who I knew had been through similar experiences, despite the fact that there was often a very large age gap. It was just nice to be able to have those shared experiences, which sort of made you bond together and made the coping a lot easier after the surgery.
I want to actually ask you both about that because you both have similar experiences of cardiac rehab. And so, Caitlin, you said that there's lots of older people that were around. Is that what you're referring to when you speak about cardiac rehab? And what was your experience of it?
Yeah, cardiac rehab was probably my favourite part of recovery. I found it really empowering. Rehab for me was a lot of emotional support and physical support. You know, the active side of things really helps my body get stronger and return to what I was prior to the surgery.
And you've both spoken about anxiety through your journeys. You've talked about how the people, your team, your support networks have been integral to your recovery. What other things do you do, Sammy, to help manage your anxiety or calm yourself down?
Does binge watching Harry Potter from start to finish count?
Absolutely.
I do practice yoga. It's one thing with my current injury that I actually can't wait to get back to more of a full practice of yoga. That mindfulness and real dedication to time that's just for you is a really confronting thing, I think, for anyone of any age to do. You know, actually giving to yourself briefly can be quite confronting, and being alone with your own thoughts can be really confronting. But what I've learned is doing that, I actually am able to manage situations on a day-to-day basis a lot better. But what's been interesting through this last couple of months was learning to pass the flame or pass the torch on to somebody else whose responsibility or job it may be to actually worry about something. And I have a sports psychologist that I speak with sometimes twice weekly, and we call it like my crap backpack. And all of a sudden, if you allow yourself to take some crap out of your backpack and put it to the side, and you kind of feel like there's a little bit less weight on your shoulders.
Super important. And what about you, Caitlin? What takes some crap out of your backpack?
I actually got into adult colouring books and mindfulness colouring after my surgery. It relaxes my mind. I can't really explain it other than that. It's almost like mindfulness and meditation, but still allowing me to focus on something, because I find that I can't relax my mind enough to do proper mindfulness. So at least when I do the mindfulness colouring, my body's still got something to focus on. So that's been really relaxing for me. And it was something I did a lot post-surgery because I needed space to just relax. And I've continued it to this day when I need a break from work or uni or whatever. The mindfulness colouring really helps me with my anxiety.
That's awesome. And I think that's such a refreshing thing to hear, that mindfulness is actually really hard. So I'm glad you found a way to have it work for you, or do it in small doses, or do a couple of things at once so you're able to focus your mind there. Well, thank you so much, ladies. Your stories are incredibly inspiring, and you both have such bright futures ahead. It's so impressive that you've been able to overcome these massive hurdles and share your story. Do you have any last pointers or any messages that you want to share with our listeners going through some similar things?
I think the biggest takeaway that I really hope, and especially was just reaffirmed so much by Caitlin, is, the journey is never linear and no one's experiences are ever the same. But if we take a unified front, together we can actually conquer absolutely anything. And I'm so proud to be here and to meet Caitlin. Her story's really inspired me of how resilient she is. And, I hope that our community really, really takes that on board. It's really, really exciting. The future looks bright, actually. It's really great.
It really does. Caitlin, any messages from you?
I would just say that I think everyone should acknowledge how they feel and acknowledge that it's okay to feel that way, and that once you do acknowledge the way that you feel, then you can sort of progress from that and find out how you can move past it. For me, that was really important, was thinking, okay, how am I actually feeling, and acknowledging both mentally and physically what I was going through, and then finding ways to deal with that was really important for me. So I would suggest that to anybody else.
Such important messages. Yes, let's all raise the conversation and connect with each other, and make sure you're acknowledging what you're going through and speaking up about it. So that's super important. Clara Chow is a Professor of Medicine and Academic Director of the Westmead Applied Research Centre. She's a cardiologist and clinical lead community-based cardiac services at Westmead Hospital and President of the Cardiac Society of Australia and New Zealand. She's also co-chair of the Secondary Prevention Alliance in Australia. We know that young people and their heart conditions and heart events is a really long recovery. What steps would you suggest that young people take to best aid their recovery from a heart event?
Unfortunately, we're seeing more and more younger people develop heart disease and having heart events. So I think it's incredibly important that we talk about this. I think young people are probably more needing to understand what heart disease means to them. So I suppose, some of my key advice might be around just trying to understand what has happened to them and giving themselves some time to understand that.
And what specifically do you see in young people when it comes to, I guess, managing their heart event in terms of medication, appointments? What are some common themes?
Well, they're busy usually, as in, they're working people. They're people that have got lots of other things going on in their lives. So it's a lot harder to do all those things. Their heart disease is not central. They're often looking after other people or including, people at work or at home. So they're juggling.
And what makes a successful relationship between a cardiologist and a heart patient?
I think that they need to feel comfortable talking to their healthcare provider, but also be comfortable to be able to tell them about how they feel that they fail on their journey and help them work that out. Some of the things I've seen in young people is that they avoid the problem. They need to be able to talk to somebody about it. They can't do this on their own.
So you kind of need to have a bit of mutual trust, don't you, that the young person has to feel safe and comfortable enough to share things with their cardiologist, and the cardiologist kind of has to be onto some of the traps or the themes or the things that might trip a young person up.
Yeah, absolutely. They have to have mutual trust, but also mutual respect for each other in terms of where they're at in their healthcare course.
And there's lots of information out there. What advice would you give to young people on where to go, what to pay attention to, and what maybe not to pay attention to?
Yeah, information overload is a problem of many of our lives. I think identifying the source of that information is important. There are a lot of organisations that are well respected that can provide information to them, and they usually include heart foundations and health organisations. I think that another problem for young people is that they sometimes think all of that information is not relevant to them, and they have to try to distill out which pieces are most relevant to them. But they are there, I think.
And we hear a lot of experiences of young people through cardiac rehab. How can a young person get the most of their cardiac rehab experience?
Yeah, I think they need to use that cardiac rehab experience as an opportunity to ask questions, check how they're going, monitor how they're going, compare notes with others, and maybe find some friends along the way that they may be able to share experiences with.
So if you're not referred to cardiac rehab, what steps should you take?
I think you should first ask whether you can be referred to cardiac rehab, either to your cardiologist or your GP that may have the ability to refer you to a local cardiac rehab service. Otherwise, local health districts, public hospitals often have cardiac rehab services, and you can self-refer to them. And otherwise, there are places where you can get support, including I know the Heart Foundation has a great support pack for people post-acute event, which could support patients in their journey as well.
Wonderful. That's all really important advice. We so appreciate your time, and I'm sure lots of young people would really value hearing what you've said today. So what is cardiac rehabilitation, also known as cardiac rehab? It's a program with a team of health professionals who provide tailored support, education and exercises to strengthen your heart. It also helps you make long-term lifestyle changes so you can live a longer, healthier life, and helps prevent future heart events. Many of our group members have attended cardiac rehab, and they've shared some of their tips in our Facebook group about how you can improve your experience. Here are their top 5 pieces of advice. Number 1, check and see if you can play your own Spotify playlist. 2, talking about stress and anxiety really helps, as everyone there can understand what you're going through. 3, ask for education about your medication and prepare lots of questions so you get a better understanding of what you're taking and why. Number 4, the first session you might find you're not as fit as you expected. That is totally normal. Stick with it. And number 5, you may be the youngest person there, but keep it up, as it will increase your confidence. Don't be shy, you can make some really nice friends along the way. Pauline Ryan is a registered critical care nurse who currently manages the support and care work within the Heart Foundation. Pauline, thanks for joining us. How does the Heart Foundation support those with heart disease?
Thanks, Carly. So we're the largest non-for-profit organisation supporting those with heart disease in Australia. Currently we know that over 1,000 people each day are admitted to hospital with a heart event or a heart diagnosis. And our role really is to be there to provide support for people going through a heart event. Not only those people, but also their carers or family members, because that's a really important element of, your journey or your recovery that we like to support as well. We're also there to provide information that's up to date and evidence-based. We know that, there is a lot of information online. It can be a bit confusing and tricky. So we're a reputable source that you can come to and actually get the latest information that is, relevant to your heart condition.
And what should someone do who's listening if they want to find out more information about the Heart Foundation?
I think one of the key messages we want to get out there is that we are here to support you in your heart health journey. So we have lots of resources available to you as a consumer, so someone that's actually got a heart condition, as well as your family members. These are online through our website. We've got print resources. We've also got our helpline, which you can call, which is 13 11 12, and you can actually speak to a trained healthcare professional. And, we can send you out information that's relevant to your condition. We also really pride ourselves on the fact that we provide, even innovative and evidence-based support programs. So we've got this wonderful program. It's called My Heart, My Life, and it's for those who have suffered a heart attack or angina episode. It's a 6-month support program, and we provide text messages, an email journey, and phone calls, as well as some booklets. And it really does sort of provide you with, insight into your diagnosis, supports you in understanding what you need to do to, improve your recovery. So what are your risk factors, what you can do to manage those, but also just someone to talk to, with the phone calls from the helpline, and just understand, I suppose, what's actually happened and the next steps you need to take in terms of your heart health recovery. One of the key messages we really want to get out there is that the Heart Foundation is here not only to support you, but provide you information. And we really do care about your heart health and your journey. So, if you're not sure about, what steps you need to take, if you've had a recent event, or even if you've just got any questions around, a family member or a loved one, contact us through, I did mention earlier, our website. We've also got our helpline, and, we want to be there and we want to help you.
Thank you for listening to the Heart to Heart series, brought to you by the National Heart Foundation. A special thanks to the Supporting Young Hearts Consumer Advisory Group, who help guide the work of what we do, and the members of the Supporting Young Hearts community who've openly and fearlessly shared their stories and experiences to help others through their heart journey. This podcast was made possible by the Victorian Government's Let's Stay Connected grant and was developed with you, for you. For more information about what we talk about today, or if you need further support, please see links in the show notes, call the Heart Foundation's helpline on 131112, or visit heartfoundation.org.au. Advice and information given in this podcast is for general information and educational purposes only. It does not constitute medical advice. Please consult your healthcare provider if you have or suspect you have a health problem.
This podcast was produced in collaboration with Joy, Australia's Rainbow Community Media Organisation. For more information on Joy and our services, visit joy.org.au.